Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. So in this video, we're going to pick up with our respiratory medications, and more specifically, we're going to talk about decongestants, leukotrienes, and Xanthines. So let's start with decongestants. An example of it is Sudafed, and the use of Sudafed is either to reduce rhinitis or which is nasal congestion. How it works is it causes vasodilation of the respiratory tract mucosa. So it causes the vasoconstriction so that blood stops gushing into the nasal to continue forming this inflammatory response. Some side effects include nervousness, palpitation, weakness, insomnia, and as well as rebound congestion when you stop taking the Sudafed. So Sudafed is a key ingredient in meth production. This is something you need to know because it's a lot in the ATI exams. And it's not sold over the counter, it's behind the pharmacist. So to monitor, right? So you'll see a question like which medication is used for mass production of, is used for production of meth. It's Sudafed. So over-the-counter product that can be found on the aisle, they usually contain phenylphrin these days. So you really don't need Sudafed like that, because they're trying to prevent the continuation of meth production with the use of Sudafed. Our next medication that we're going to talk about in this video is leukotrienes. So a leukotriene receptor antagonist. Example is Montelukast, Singulair. It's normally given for prevention. This medication will prevent inflammation caused by asthma attacks. So the leukotrienes, they end with lukast. So when you say lukast, you just know they are leukotriene receptors. They use it, as we said, they are for asthma, and they are also used in the prevention of exercise-induced bronchoconstriction. So that means you actually take them before that exercise, okay? Its mode of action, it reduces the effect of leukotrienes in the body, which are inflammatory chemicals that are released in response to an allergen. So, these meds side effects include headache, and zafirlukast increases liver enzymes. So, if you have a patient who's taking zafirlukast, always check their liver panels, okay? So, with Montelukast, we should take it, or you should advise patient that they need to take it in the evening or 2 hours before exercise. For zafirlukast, it's recommended to be taken on an empty stomach. This is a common ATI, NCLEX, HESI question in regards to this leukotriene medication. Singulair, which is Montelukast, it's preferably taken at night before bed. But there is also a question in ATI which also offers the option of when to take it, and there is no option for night. And the option will be 2 hours prior to an exercise. Some cool key way how to remember the leukas is the lux opens airway, and it's long-term management of inflammation, and it's long onset, so it takes at least 1 to 2 weeks to reach its therapeutic range. So you have to keep taking this Singulair at night for you to stop having this inflammatory or an allergen responses in the morning. So let's talk about Xanthines, and our example for this is Theophylline. Theophylline is one of the medication that is used for our respiratory, and we really need to monitor this medication. So, what is it used for? It's used for long-term control of asthma or COPD. Its modes of action, it increases the AMP, which ultimately it results in bronchial dilation. It's mostly taken in the AM in the morning, and we always avoid caffeines or any stimulants. Some side effects include GI upset, headaches, nervousness, and dysrhythmias. This is why we really monitor this medication because of dysrhythmias. So due to dysrhythmias, this medication is not mostly used often for our COPD and asthma patient. It's always stopped before a cardiac stress test because of this tendency of having dysrhythmias, right? So we don't have a false kind of test. And due to it being with this dysrhythmia side effects, we regularly draw blood to monitor the theophylline therapeutic levels, and its levels are normally between 10 to 20 micrograms per milliliter. So some key points you need to know about theophylline include it's toxic over 20 micrograms per milliliter. It causes tonic-clonic seizures. That is one of the first signs of its toxicity, and it is prone to tachycardia and dysrhythmias. So we also avoid beta blockers that decrease the heart rate since it blocks the effect of theophylline. And we always notify the doctor if the patient has tachycardia before we administer this due next dose. We are monitoring for this side effects closely, so we always monitor this. And some drugs that increase its toxicity include H2 blockers and ciprofloxacin, which is an antibiotic. An example for H2 blockers is cimetidine. So we'll get to our next video. Let's continue talking about other respiratory drugs. See you in the next. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.